Hey guys, welcome to Dr. Hampton's live stream. I'm so happy that you are here with me today, particularly because it's a holiday. And I know many of you are probably out having fun with your friends and enjoying the Labor Day weekend. But this is not considered work to me. This is purpose. So I'm really excited that you came. And today, as a holiday treat, whether you watch it live or not, I have a really good friend, Dr. Salcido, who is a OB/GYN doc. I met her when I started speaking for the Low Carb USA, now the Symposium for Metabolic Health in San Diego, where she actually lives as well. She is a board certified OB/GYN in Southern California. She practices with Loma Linda University Health, which is really cool. She treats and addresses those gynecological medical conditions. She particularly likes to incorporate lifestyle into her approach. As you could imagine, although we're open to all dietary patterns. I mean, she is at Loma Linda, right? So Loma Linda is known for more of a plant-based approach, but she is one of those outliers there in that she focuses on a low-carb, high-fat diet. And but she's also an OB/GYN, so she deals with a lot of medical conditions women face, like uterine bleeding, endometriosis, and infertility, etc. So I really appreciate her, and it looks like she is now here to join us. Welcome, Dr.
Yay.
Salcido.
Hi, everyone.
Yeah. And I want to do first of all, I want to thank you for carving out some time to be with me and my audience on a holiday day. And again, for those who can't do it now, we get it. And hopefully there's an opportunity to check it out later. We're going to allow you guys to ask some questions about anything that's women health related. But what's really important for me right now, as Dr. Salcido has a YouTube channel herself, it's called Conscious Gynecologist. So I want to make sure that you guys are aware of that. In fact, if I would love for you guys to even go to her channel and subscribe. It's a growing channel, but what I love about having Dr. Salcido out there is that she has a similar mindset as I do. But she knows more about women's health than me. Now, I've delivered babies and done all that good stuff, but I don't live in that lane that she's in. And I just think that so many problems that are women health related require somebody that's really doing that on a regular basis. So I want to kind of kick off before we get any questions with a couple of questions that I have. And the first for Dr. Salcido is, you started a YouTube channel so you can spread this message about metabolic health. I guess the question is, why did you decide to do that in the first place?
Yeah, that's a really great question. And thanks so much for having me. And this, exactly what you said, this is not work. This is a lot of fun and it really rejuvenates me. It fills our cup to kind of spread the word of lifestyle for the community. And I work in a really unique place. I work at Loma Linda, where it is a blue zone, and we have these this incredible tradition of longevity and health. And I really do believe that what I'm doing is completely in line with all of those things. But in gynecology, it's a little bit more focused, where we really do try to reduce inflammation and insulin resistance. And a lot of gynecologists really do help women with polycystic ovary syndrome. And a lot of that has to do with irregular periods. And a lot of that also comes from high insulin levels. And so I found myself telling patients over and over the same thing. And then, if you're like most people, and even including myself, when I go to the doctor, I only remember like half of what they say.
That's right.
And so to take the edge off of a lot of the teaching, right, because I really do come from a teacher's approach. I used to be medical students and residents. And so I started to really just come from the love of teaching and teaching patients very simple concepts of medicine and gynecologic health. And then it just grew to a YouTube channel because I wanted them to be able to hear the message again and again, or maybe share with their family members to help incorporate what we're trying to do to really help them achieve health. And so It's small, but it's tiny but mighty. And I think like the majority of the people on there are people who really do know me.
Yeah.
But I think it's getting bigger, and I haven't dropped a video in a couple of months, but I think it just goes to show how real my life is. I have kids, and we're at home in the summer, and so
Mm,
when I am able to share some time with folks in the community, it's usually Mondays, but the kids have been home, and so
right.
today I did my first video when I kicked the kids out, and there should be a video dropping this week about the endometriosis, and it's
Yes.
going to be really exciting. So thanks for the
Yeah.
opportunity.
Oh, yeah, most definitely, and I agree that, there's a lot of work in, making time when you're busy. Doctors are super busy, and, but again, I also think that's a great tip for any clinician out there. You know, if you make videos that answers a lot of the questions, like I have a video, "How to Adopt a Low Carb Diet," so I don't have to spend a lot of time in the clinic. I can say, "Hey, check out this video," and then I can focus on other things. So I think we're all trying to build up our video catalog so we can do a better job with that. So now I want people who are checking us out to share where you're watching, like what city are you in. If you're in another country, share that as well. That would be very fun to know. And then also, again, if you have any gynae questions, let us know. I wanted to go towards the research. One of the ways to legitimize metabolic health, low carb, keto, etc., is to do research, right? So when I saw that you had done research not once but twice, I was very proud, number one, and then very impressed because I think people need to see that for us to establish credibility. So talk a little bit about the study you just did. I think it was called Therapeutic Carb Restriction as a Metabolic Modality for the Prevention and Treatment of Abnormal Uterine
I have it
Bleeding.
here.
You
No.
have it. Good. There you go. Cool.
And yeah, so this paper just came out. It's a clinical opinion piece, and it's actually truly a call to action for the gynecologic and medical community at large to really apply the principles of end organ damage, inflammation at our endothelium, blood vessel inflammation that will feed every organ in our body, heart,
Mhm.
lungs, kidneys, but we don't really think about the uterus as a
Mhm.
recipient of inflammation, nor the ovaries. But
Mhm.
however, those organs receive just as much inflammation that lead to chronic medical disease chronically over time. And really, the biggest sign of impending cardiovascular disease risk for women is an irregular or painful period. And so
Mhm.
my feeling is I made a huge argument for how that disease process happens.
Mhm.
And then it's a call to action for the gynecologic community to really look at that as we need to be sharing this information with patients about how women have got to where they are, because OBGYNs and doctors are really great at helping control bleeding, helping with
Mhm.
medications and surgery. We're really good at that because oftentimes women just can't live because they're flooding, because they can't, really keep up with the pads and stuff, and it's expensive. And so while there's definitely a role for medications and surgery, and believe me, I do that stuff too,
That's
I
right.
really want to tell patients about how they got there. And even initially, when those bleeding patterns start to change, I want to teach them maybe what they can do early on to prevent things. And it's all
Mhm.
about reducing inflammation, all about reducing insulin resistance. And so that's what the paper is about. And I also do a fair amount of clinical research. I've had a couple of other studies published you may not know,
Cool.
and I'm actually doing a case control study right now looking at insulin resistance among women with abnormal uterine bleeding, and hopefully that'll finish off this year. I did have a case, or a cross-sectional study looking at women with abnormal uterine bleeding a couple years ago, and 60 to 70% of those women had insulin resistance.
Okay.
And so that's really huge. And so I'm comparing it to a control group now. And so, right, you're right. Like, we're just continuing to compile compile this research to help other doctors and legitimize what's already been known for many years. So
That's real sweet. So I'm going to do a shout out to a few folks. D. Lee, who's saying hi to myself. Of course, saying hi to you. I shared your YouTube name, so people would check that out. And again, I want you guys to check out that site and subscribe. We got some shout outs coming from D Dog, a B Dog. You can't, you gotta love that name, right? and more shout outs here. So we're gonna keep looking. And here's more. You remembered, LOL. I love that. And I'm just gonna share a few of those. I asked for location, so we got College Station, Texas. We got DeKalb, not far from where I'm at. Pearland, Texas, and gotta love that. We I think we both know Tia. She's a she's a socialite, right? So she's our low carb socialite. So shout out to her. I think she won an award for that. We also have Pearland. We have California, where you're at on your side of the horizon, more close towards me in Des Plaines. And 2 Illinois, 2 Texas. They must be doing a family gathering thing. And of course, hope we're doing well from Sam and a subscriber. Hey, that's what I'm
thank
talking
you.
about, D. Lee.
Thanks,
Let's
Julie.
follow D. Lee's
Right.
lead there and watching it with my wife. We're all about family. In fact, we're not gonna be on for a long time because I got a wife and she got a husband and some kids. So we're gonna definitely make sure we get back to them. A shout out from Sam again, and South Holland, which is the south part of our city. Of course, Chicago, where I'm at, and my insulin resistance was in my labs for 2 years. Never mentioned at the office, just saying. And we need to get docs to start doing. I know Sherry Johnson, she works with me, but we got to get doctors to start doing insulin levels and some other metabolic tests. So guys, any questions, go ahead and throw it in the chat. I do want to ask you about fibroids, because a lot of times why we get fibroids, right? And what's up with that? So if you could just comment on that, because a lot of people, they'll look at their family history and say, well, all the ladies have hysterectomies and have fibroids, and they think they're destined for it. But why don't you share a little bit about why that's not necessarily the case?
That's right. And I love talking about this and sharing this message because, I think that women are a little bit siloed in that, where they think that fibroids and, are just part of their destiny. And the interesting thing is that 70% of women will get fibroids in their life, and 80% of African American women will get fibroids in their life. And the hard part is that we know that fibroids are basically cardiovascular disease of the uterus, which is incredible to understand when we look at microscopically. And we've known this since the 70s, or these amazing pathologists looked at this and saw that the same cells that cause hardening of the arteries or atherosclerotic disease, those myocytes, those muscle cells, were the same ones that cause uterine fibroids, which is incredible to think about. The uterus is just one big smooth muscle, just like the lining of our blood vessels. And so when there's inflammation, they're just going to cause a lot of calcification and growth. And then that will stretch the uterus and cause more surface area to bleed. A lot more pelvic pain, discomfort can sometimes be associated with infertility and pregnancy complications. And so truly, your uterus, when you're starting to notice problems with that, is really just showing you that, man, your body's receiving it. It's hurting, and the reason why that there might be a little bit more of this in our African American community is because there might just be more chronic disease that starts earlier from being a person of color in this country, with a lot of just, like stressors that folks receive a lot earlier on. And so while genetics do play a role, they're actually on the bottom of the list of risk factors. The higher risk factors are hypertension, visceral adiposity, which is kind of like more more chubbiness in the midsection,
Right,
and
right.
diabetes. Those are kind of the risk factors. And myself as a woman of color, a lot of the folks in my community also experience a lot of these things. And so that, coupled with family factors, really does present women and to receive these insults, these chronic insults over
That's right.
time that can lead to medical or surgical management. So
That's right. And when I think about protecting our nest, it makes me think about this concept that there's not just one thing. Obviously, we believe that a low carb diet will help to reduce inflammation and help, but that's only one aspect.
that's right. Mhm.
You gotta don't over exercise, but the nest talks about exercise. It talks about reducing stress. It talks about getting sufficient sleep. And if you think about stress and sleep, if I were to pause there, um, the lack of sleep will, set off your fight or flight response, and
That's
the
right.
cortisol level goes up. So one of the things when I was delivering babies back in the day, I couldn't understand why on the west side of Chicago, why would the women have similar infant mortality rates as third world countries, right? And why would a educated woman of color like my wife have the same rates of infant mortality compared
That's
to
right.
their white counterparts? And what they're finding, at least one reason, is that there's a chronic like cortisol,
Mhm,
stress. It's like
mhm,
chronic stress, and
mhm.
and so even a person with resources, maybe that professional lawyer or like my wife, pharmacist, educated, has all of those benefits, but yet they're under a lot more stress because society treats them different. Maybe
Yep.
they have more things to deal with. Maybe
Yes.
they're family stressors, et cetera. But the good news is we can start to mitigate that by focusing on the things that we can control. And one of them is what we eat. And then of course, making sure we prioritize stress. Now, what they did when I saw a study, they talked about the infant mortality rate being higher and how women had all of these pregnancy related complications. They found that the missing link was not anything other than feeling a sense of isolation and not having community. So simply by adding a sense of community, they were actually able to improve outcomes. And that's not even expensive. That's just getting people
That's right.
together. Yeah, so I think that's important. Let's also do a shout out again to Dee Lee talking about appreciate our time. Another superstar in my mind is Tracy McBeef. Gotta love her. Was able to see her for the first time in person in San Diego at the Symposium for Metabolic Health. If you search her name, and maybe Tracy, if you could put in the chat the name of your TEDx talk, share that with the group because it was such an inspiring talk. And I would love for you to share that with the group because you are an inspiring person, one of the nicest people you'll ever meet. Then we have a hello from Roseville, California. I'm not sure where that's at. 52-year-old female, cycle 26 to 28 days. Recent cycle went 44 days. Is that a sign of a transition to menopause? Am I too old to be having regular Sorry. Yeah, that's
Oh,
funny.
yes.
So any thoughts on her comments there?
Yeah. So, well, you know what? This is not like a forum for, direct medical
Right.
advice. I can tell you about what I know and what I teach patients in similar circumstances. And so, definitely, I mean, the menopause transition is 10 years. And so, normally your menstrual cycles can last anywhere between 21 to 35 days. And that's very common. And so, but once in a while, as you start to get a little bit older, you may skip a cycle or two. And that just means that there might not be enough ovarian ovulation or reserve to kind of allow for that regular monthly cycle. And you'll skip one here or there and stuff. And then maybe for 2 or 3 months at a time when you're starting to get a little older. But the average age of menopause is 51, and that's just an average, right? And
Yeah.
so there's some people that start before then or after that. And so so it really kind of just depends on you and how things are going. But yes, it's it's a process. I mean, I'm in that 10-year gap. It's coming for me. It's
That's right. I hear
it's
you. Yeah, it's
coming for me
coming.
because
Yeah.
it's such a new womanhood, right? And it's a new
Yeah.
level of maturity too. and empathy as we help women through this process. And I just wanted to speak to the point you were talking about with like similar infant mortality and
Yes.
maternal mortality rates. There's a really great book if anyone's interested by a public health researcher named Arlene Geronimo, and she's from University of Michigan, and she created the concept of something called weathering. And weathering is the chronic stress that disenfranchised populations received over time. And it's just an incredible read. She just published it about 3 or 4 months ago. And it's one of those books that are so jaw-dropping, so it just really speaks to your soul of what certain folks experience, that you have to take it in little bites, because you just can't believe some of the stuff. And you're right, even such similar socioeconomic status, but similar groups of color, but different status is just incredible. And so I really also like to really legitimize that with patients when I have in front of you. It's like, man, you really are a recipient of chronic stress, and that's not like a foo-foo thing. That's real, and Dr. Geronimo has done lots of incredible immunologic research that look at the white blood cell counts are different, and it's just really great. So thanks for bringing that up and for really speaking to that.
Weathering. So I'm going to look that up. Yeah, we got to get that because in my health system, we're really starting to focus on health equity. And in order to make sure there's no health inequity, meaning that everybody gets the same kind of care, everybody is treated fairly. But part of being fairly treated is to understand the differences between us, right? So if I know a population has different labs, like, for example, African Americans may tend to have a lower white count than other cultures, right? Then I won't look at that as an abnormal, but there are times when I need to know, like what you're saying, is there ways to measure chronic stress? Is there something I should look at? So I think that's really awesome. I just want to
you need to have her on your podcast. She's incredible.
It sounds like it. I'm definitely going to look into that because that's really timely. Tracy again thanking us, and I'm pretty sure Tia here is, because she's a socialite. She probably is sharing a link to the TED Talk, I'm assuming. So that is there for people to consume and check out. And then we have another from Pennsylvania. So hello, Veronica, for joining us. Another thing I wanted to touch on real quick is, what the heck is endometriosis, and what does that have to do with inflammation and metabolic health?
Well, thank you. It's like my second favorite topic after I think just bleeding issues. But I did publish something recently coming out in this September, and it's in the Journal for Primary Care and Family Physicians called Primary Care Reports, just hot off the press. And it looks at endometriosis and the gut microbiome, nutritional prospects in the treatment for chronic disease.
Nice.
And where does nutrition fit with endometriosis? Well, I mean, there's so much to talk about, but one of the big things that I want to describe is how difficult it is to treat endometriosis, and how when you're a patient with endometriosis, it can take 7, 8, 9 years to even get a diagnosis and see 3 or 4 different doctors and stuff to help really understand the pain and the discomforts that people are going through. But endometriosis is a disorder where the lining of the uterus will somehow migrate outside the uterus and implant in various spots of our pelvic and abdominal cavity. And there's even weird case reports where they have found it in the lungs and in the brain and stuff. And so for over 150 years, people have had various theories about how endometriosis has come to be, through the lymphatic system or the circulation. But the big theory right now is something called retrograde menstruation. And that is when the lining of the uterus, and this is in everybody, the lining of the uterus during the menstrual cycle of a reproductive age woman will come out vaginally, just like we normally would think it would. But also with everyone, it happens that the lining of the uterus migrates out through the fallopian tubes. And so as it migrates through the fallopian tubes, it implants in our pelvic cavity, or it actually just goes there, and our normal immune system will process the blood and kind of take care of it. Now, here's where gets really exciting, is that there's a concept of something called gut dysbiosis. And gut dysbiosis is when there is inflammation at your intestines that allow inflammatory molecules and pathologic or bad bacteria to leak through. And that also leaks through into the pelvic
Mm,
cavity. And
mm,
as it's leaking through the pelvic cavity, then your immune system activates to process that. But here's what really happens. And so as it's processing it, those mast cells, those immune cells, those neutrophils are activated, and then when your retrograde menstruation occurs, those endometrial cells, menstrual cells, will implant at the areas of immune inflammation from the gut dysbiosis. When that happens, then there is something called neovascularization. That means there's new blood vessels that actually form between the endometrial cells, the menstrual cells,
mhm,
and your pelvic cavity. And so then it creates a new connection. And so then those
mm,
menstrual cells are active, and then they bleed just like any other menstrual cell would in the lining. And so every month you're having this terrible, debilitating pain that can actually even be present since your first period, which
mm.
is why that this endometriosis we're learning is more of a gut microbiome disturbance, not a gynecologic disorder, right? Which is whoa, right? So
That's
there's a lot of really great data that actually supports this for since about 2014, 2015 that we're really starting to know this and learn about this. And so I compilated a lot of the research and I put it together for some primary care doctors to start teaching patients about what is going on. And so that's why birth control and surgery and stuff, although very helpful,
yeah,
aren't necessarily the solutions
yeah,
because they just help stabilize the lining of the
that's
uterus,
right.
but they don't treat the inflammation. And so here we go again. It's just trying to figure out what is your trigger, right? What is your inflammatory trigger? And for some people, it's processed food, and for some people, it's carbohydrates. Some people, it's gluten or lectin, and some people, it's trauma. And
Right.
so there's all kinds of layers, and that's what's really exciting is because when I have consultations with patients, I can kind of teach them about that physiology. I think
That's
it's
right.
pretty
That's
simple to
right.
understand. And then once you get that, then we can figure out the trigger, and that's really exciting. And so that also teaches patients that there's not just one fix, right? And
Right.
this is just like a chronic thing that you're gonna have to know for patients will have to know, and myself included, I have endometriosis myself. It's like, what are my triggers? What do I need to avoid? And then when I can definitely notice when my life is out of balance because I'll have a
Mhm.
heavier period or more painful period. And so it's like, okay, I need to kind of cut back on certain things and stuff. And so it's really helpful because it teaches women to listen to their bodies. And so this new approach of understanding endometriosis has just revolutionized my practice. And it's actually my most subscribed or my most watched video on
Oh,
my
yeah,
YouTube
I can
channel.
imagine. I mean, well, it's fascinating because a lot of people will, ask us, your hammer for everything seems to be low carb, keto, or carnivore. But if you really think about what you're saying, number one, smooth muscle is all over our body. So if you do any intervention, rather it's reducing stress, eating better, or getting more sleep, etc., being in healthy relationships, that's probably going to help your smooth muscle everywhere, which means it's going to help everything. So whether it's your uterine tissue, your breast tissue, the arteries around your heart, and so for those who are watching, that's why your diet is so important. Now, going back to diet, who knew your gut? We learned things about the gut. Well, your hormones for your mood are made there, like serotonin. But who knew that the gut would have anything to do with your uterine health? And it's just mind-boggling. And what's particularly exciting is that we're just getting started. The
Mhm.
microbiome is like a new frontier.
Oh, sure.
I would argue metabolic health is fairly new for most people. Most doctors at Loma Linda or with Advocate Health, where I work, are not thinking about it as a first thing to approach. So, but the good news is if you approach it, you're gonna really do well. So, a couple of really quick questions related to like cancer. So, we think about breast cancer in women. Any thoughts about how this concept of metabolic health can impact your risk for cancer, in particular breast cancer?
Yeah, I think that oh man, metabolic health and breast cancer. I think I'm not a breast surgeon and I'm not an
Right.
oncologist, but we do know that, ladies who struggle with metabolic syndrome, obesity, those things will also impact our ability to handle chronic medical disease, particularly with vitamin D, which is very interesting because the study that I published recently revealed that women, again, it's kind of like saying the same thing, who have endometriosis are found to have 30% lower vitamin D levels than a lot of other folks and stuff. And vitamin D is a potent anti-inflammatory, it helps immune modulator. And so it's very, very helpful to kind of look at that in terms of it's just another piece of the pie, and this is just another issue that there's not one answer, right? There's not one solution. We
Right.
we
Yeah.
know that all of these things affect women, but it's it's funny and it's easy to silo women of like, oh, breasts, you've got that problem, it's hormones, or uterus, that's bleeding, that's hormones. And I think that a lot of times women have been suffering silently, feeling that their chronic medical condition is a function of their womanhood. And that is only partially true, right? Because
Yeah.
all of our organs receive inflammation differently, just as like our male counterparts have problems with, erectile dysfunction and prostate and those kinds of
Right.
things. It's just a different manifestation of the same story, that we talk about over and over, and so yeah, I think, and honestly, polycystic ovary syndrome, irregular bleeding, endometriosis are all risk factors
Yeah.
for uterine cancer. And so, that's kind of my silo of like, how do we reduce your risk for uterine cancer? And
That's
yeah,
right.
it really does start with like the boring lifestyle stuff from the very beginning.
That's right. And it's nice to know for us who have nieces and daughters that if they are having polycystic ovarian, we can do something about it. And it's not about just taking metformin, it's about reducing the inflammation through our lifestyle, primarily through diet. And I could imagine when Tia said, wow, I was just as amazed as you started sharing that I'm assuming that's that gut, thing going from your gut to your uterus. And I was saying, wow, in my head. So thank you, Tia, for throwing that out. And I agree, Tracy, the information is awesome. And we appreciate that. Here's another comment. Is the layman able to have access to your report? I suffered terribly with endometriosis my entire adult life until postmenopause. Probably as a teen, also, I had surgery for it. It was on many surfaces. Thank you. So giving access to that report is something that is it available yet or is it coming out?
It's out, and then we can
Okay.
post the link. But if you just do just a Google search right now, primary care reports, endometriosis and the gut microbiome, you'll find it.
It'll come up.
And
Okay, cool.
it's
Okay.
open access, I believe. And
Okay,
so
cool.
and then the other nutrients one is also that's also open access as well. We've paid
Perfect.
the money so that this is something that's accessible to everyone, and you can bring it to your doctor and say, hey, I
That's
brought you
right.
something to read.
Right, right. And I think that's important because a lot of doctors, they look at drug studies and things like that. Let's give them something that kind of focuses on something totally different. Tracy, nothing is a silo, is it? What a concept that it's all connected. Yeah, when I was in my nutrition and functional medicine training, they use the term interconnectedness often. And I absolutely agree with that. And I know insanity. I want to say shout out to Renee. I've definitely had a chance to interact with her through these platforms. Well, I guess I will watch the replay. I guess she just joined, so she's like, "Well, that's thank God for technology, right?" So you'll be able to do that. D. Lee, okay, thank you, and of course, good medical stuff. So we're not going to stay on long, guys, because we do have significant others who are probably by the door waiting for us to kind of join them. And me and my wife have dinner to have tonight. So I just want to kind of, wrap up our conversation, with any thoughts you may want to share about, well, let me just do this real quick. Hold on. I'm just going to try to grab this real quick. Mariana, what correlation does endometriosis have with any of the mast cell conditions? My half sister had endo and thyroid issues. I have thyroid, had PCOS-like symptoms, and mastocytic enterocolitis. So any thoughts on those concepts?
Yes, there's so much the mast cell conditions and, kind of avoidance of like different histone diets and things are really come to mind. I have a patient right now who's got mastocytosis that has very much the symptoms of endometriosis as well. And when we see folks that have these chronic inflammatory conditions, particularly immune conditions, it really is just a sign of inflammation, and your body's trying to fight something, right? And so it kind of goes down the line of the fight or flight nervous system, the autonomic nervous system, sympathetic nervous system, of fight or flight. And so one example that comes to mind, and I'm not thinking that this might be your family history, Mariana, but it's definitely something we think about, is that when folks experience a significant trauma, and we know that about 33 to 40% of women who have endometriosis have some sort of trauma in their life. And that trauma can tend to activate our fight or flight response and cause, elevations in our immune response, mast cells and neutrophils and all of those things. And so as they're activated, it's because your body's getting ready to fight. And so the challenge is, though, if you don't fight or flight, then that activation of catecholamines stays elevated until you can discharge it. But if you have this activation of catecholamines, then you have high glucose levels, and the high glucose levels are getting ready for your muscles to fight or flight. But if you can't fight or flight, that's when it's really important to understand, because that never gets discharged. And so then your insulin level goes up to be able to counteract and kind of bring down that glucose level. But it's the same thing that goes with the immune system and the mast cells and stuff, because they're all immunologic agents. And so if your body feels like it's under any kind of stressor, then those will be chronically elevated. We see that in all kinds of chronic conditions, rheumatoid arthritis, sarcoid, lupus, all of these things that activate immune response very subtly can damage over time. There's a really great book. It's called Chronic, and it's laid out very, very well. It's this Harvard psychiatrist that talked about the immune system that is chronically elevated that leads to all of these problems. Another book that comes to mind is The Body Keeps the Score, and then another one from Gabor Mate, When the Body Says No. Those are all incredible descriptions of immune cell activation. And then the polyvagal theory too also comes to mind when we see how the immune system is activated through the fight or flight response as well. So there's just so much to learn, and definitely endometriosis can be categorized as one of those chronic inflammatory states. So
yeah, that's crazy. Now it's funny. I'm looking at this. My assumption, if somebody asked me about carnivore, keto, or low carb, I think any of those low carb dietary patterns can improve or reduce inflammation. So and I would assume I can't quote a randomized controlled trial for this specific question. I had not heard of a sea lion diet, but I guess if you think about what sea lions eat, maybe that's what. so I guess it's a version of some type of diet from the sea, but I'm not familiar. I don't know if you've ever heard of that type of diet before,
well,
Doc.
I haven't, but what comes to mind is diets high in omega-3 fatty acid, right?
Yeah,
So any
yeah,
diets that where there be lots of, kind of fish and
that's right.
kind of sardine style things where high elevations of omega-3s that really do help reduce those chronic inflammations. And so, and I see kind of one of Robin's kind of talking about, someone who's scheduled for a hysterectomy.
Yeah.
And just because the uterus goes away doesn't mean the problems are going to go away,
Right.
which
That's
is another
important.
thing to tell patients is that, I always tell them if I do a hysterectomy for endometriosis, that's not entirely the solution. It helps a ton, believe me, because if you're bleeding crazy heavily or having really painful menstrual cramps, it's just one piece of the solution, right? And so the article definitely shows a lot of nutritional supplementation that will help. It's vitamin A, which is very interesting. Vitamin A is the building block for butyrate, and butyrate is this really cool metabolite that's produced by the gut microbiome.
Mhm.
And so your gut microbiome needs vitamin A to produce butyrate, which is a protector of the gut.
Mhm.
And so that's really cool. And so, I talk about vitamin D and omegas and vitamin A and fish oil, and also reduction of trans fat intake. But I also want to stress that it's not like go take a pill, it's more like really try to incorporate all of those things
Mhm.
in our lifestyle so that we don't have to rely on supplementation if we can help it, right? And so that's kind of the take home message, is that really try to get those things from nature, because that's kind of what this is all about. So
Yeah, nature, your body is just more equipped to address nature better in terms of how we use things. Supplements are okay. Like I do take a high potency omega-3 because I don't eat enough seafood, but ideally you get it from the food. I do want to do a shout out. First of all, everybody subscribe to the Conscious Gynecologist YouTube channel. I think that would be worth. As you can see, our doctor is well versed. She's doing research. She speaks at the national conferences where I met her. But I also want to do a shout out to the carnivorous grandma. I know she doesn't look like a grandma, but she's also agreed to be on the Protecting Your Nest podcast. She is on her carnivore journey and doing really well, lost weight. And I just think that we should support her channel. So if you can kind of slide over to, so you have two channels to subscribe to now. And I really want to support anybody that's out there trying to spread this message. B dog, I know someone with mast cell syndrome. Um, Mariana, and is it related to breast cancer? I'm assuming that's just the basic inflammation. I'm not sure if that's mast cells, but the answer is probably going to be a yes to that if it's inflammation. Thank you, doctors, for the great information. Great work. Thank you very much. Is a lion diet with it's a lion diet with seafood. Okay, gotcha. That'll work. So thank you for that. Let me tell you something. The reason why this is important is because so many of us are still learning. I mean, me and Dr. Salcedo, we're not experts on anything. I have a master's in nutrition, and I don't know. They didn't talk about that in my master's for nutrition training. So here's a doc who wants to share great team work. Lifestyle is a major factor in health, runs through every stage in life and applicable to many disease states. I found this collaboration quite informative. Thank you. And thank you, Doc, for just being here. We
thank
need doctors like
you.
you doing what you're doing. Here is another comment from Mariana. It sounds like systemic inflammation from plants triggering autoimmune conditions. As I eat mostly beef, salt water, and seafood, fish, I tend to feel better. Reintroduce my meds makes me react from plants. Well, let me just say this. Everybody's different, and there are people who eat plants that do fine. I just don't do fine with plants, so you have to listen to your body. So that doesn't mean no plants at all. I just lean towards a more animal-based diet. Robin is just doing a shout out again, just thanking us. Can't wait for the interview, and I can't wait to share it as well. B dog, that is carnivore kip diet. He started this month. He give up his shrimp. Yeah, I like shrimp too. So yeah, so guys, again, I tried to end it earlier, but you guys kept coming. So I think for the sake of time and Dr. Salcedo, I want to go ahead and give her a chance to, say any final comments as we wave at Tracy. Again, please go to the link that was previously shared, and you'll love her TED Talk. Really just kind of putting life in perspective. And she just framed it in a very nice way. So I really appreciate her. And of course, our socialite, Tia. So any thoughts as we wrap up, Doc? Any final messages you want to share with the audience, to the ladies out there who want to be healthy, want to be here, protecting their nest? Women are very good at protecting their nest, right? So, I mean, I know my wife does that. I mean, she's always calling my boys, and my youngest son is on his way to was on his way to St. Louis. She's called. I need to know when you leave. I need to know when you get there. So, any thoughts about that you want to share with the group before we wrap up?
Yeah, I just want to share that women inherently know when something is off, and especially of women of reproductive age. And so our regular menstrual cycle is truly the biggest and most important vital sign for us women, because something will happen when a woman misses her period, particularly if she's sexually active, and she'll think like, oh, am I pregnant? And that's evolutionary. That's something that is visceral that we just can't help think about. But if we're not pregnant, then what's wrong, right? And so
Mhm.
then that will tend to lead to a lot of discussions of these inflammations. And because we do know that whenever a woman is under a stress, insulin will rise, and any stress
Mhm.
can do that. And so,
Yeah.
but carbohydrates do it commonly in our standard American diet. But that rise in insulin actually sends messages to your brain hormones to stop ovulating.
That's
And so,
right.
if you stop ovulating, then your period might not come all the time. And that's just nature's way to keep you not pregnant at a time that's not very safe. However, over chronically time, then it really just starts to impact and cause a lot of concerns with irregular periods. But then that inflammation can bring up the fibroids, endometriosis, and all
Mhm.
those things that we've talked about. And so my message really is to honor your menstrual cycle. It shouldn't be a terrible experience. It should be a welcome understanding of our monthly cycle and reminder of womanhood and healthy womanhood. And so really, if there is any struggles with your period, please let your doctor know. We're here
Mhm.
for you. We want to help you navigate. Flooding and things are just no way to live. We really want to help walk with you through that path. So thank you
Yeah,
so
thank
much.
you. Thank you so much for being here. Again, more tips, guys, on how we can protect our nests, and no better person than Dr. Salcedo to share that. So I definitely want to encourage you guys to, again, check out the YouTube channel. We're going to make sure she finds time to make more videos, and it's the Conscious Gynecology Collegist YouTube channel. I definitely do a shout out again to Robin, who joined us, who has the Carnivorous Grandma, YouTube channel as well. And again, she'll be a future guest on the podcast. We're really excited about bringing information directly to you, give you a chance to kind of interact with us as well. Although we will be making videos that just present information as well. If you have further questions, it's not too late to throw some in the comments of the actual video, and we'll circle back and make sure we answer those questions as well. So I really appreciate you and your family, Dr. Salcedo, for, tell your husband, I didn't get a chance to see him when I was in San Diego like I normally would. He was busy doing other things, but let him know I miss him. Looking forward to connecting with him in the very near future. And of course, your beautiful kids. Shout out to them as well. And for those who kind of joined us tonight, I know it's a holiday night, for you to carve out some time to spend time with us, and just to value your health enough to like spend time with us. When you could be watching Netflix right now, you carved out some time to be with us. So we really appreciate that. I hope the information added a lot of value to your life. And until we do this again, guys, continue to be safe, be well, and continue to protect your nest. And thank you, Doc, again.
Thank you. Enjoy. Have a great night, everyone.